Hello everyone, this is Dr.Abinaya Vijayakumar. I am a doctor, a motherhood empowerment coach and an international #1 best-selling author. Today in this video, we are going to discuss in detail about ultrasound scans in pregnancy. Many a time, mothers come up to me asking the questions like, I am having frequent ultrasound. Is it any problem or harmful to my baby? No, not at all. Ultrasound scan is not any form of radiation like X-ray or CT scan. It uses ultrasound waves, which is completely fine for you, your pregnancy and baby. So even if you have 1,000 ultrasound scans during your pregnancy, it's absolutely safe. Your baby is safe inside you. You don't have to worry. Regarding when are the scans to be done and how many scans is minimum to be done. There are few scans which is compulsory during your pregnancy to ensure that your baby is doing fine. Number 1 is confirmation scan, which is done at 6 weeks of pregnancy. It has to be done during the 6 to 7 weeks because first you have to confirm that it is an intrauterine pregnancy, which means that the pregnancy is formed inside the uterus and not anywhere outside the uterus, which is not a good thing. So to confirm this, you have to do a scan at 6 to 7 weeks. And during this scan, you can also check for fetal heartbeat. Usually, the fetal heartbeat appears between 6 to 7 weeks of pregnancy. Always it is a range and it's not a single number. So you can wait up to 7 weeks to confirm the heartbeat. Second scan would be done around 11 to 13 weeks, which is called NT scan. During this time, they measure something called as the nuchal thickness, which says that the baby's brain would be formed from this nuchal tube. So the measurement of this tube is very important to make sure that the baby's brain and spinal development is in place and there is no problem with that. So third scan would be done around 18 to 21 weeks, which is called the Anomaly scan. This is a detailed scan where they go in detailed evaluation of your baby to see if the baby's heart is fine, eyes are fine, nose is fine, kidneys are fine, abdomen is fine, external genitalia is fine, everything. So this Anomaly scan is very important in pregnancy. The fourth scan would be a growth scan, which is done around 28 to 30 weeks, which is to measure the interval growth of your baby. That is, you have done a scan at 20 weeks. Now that you're doing a scan at 28 to 30 weeks, so it has to be, there should be a difference in the growth in your baby. So there are certain parameters to ensure that the growth is within normal range. The next scan, the fifth scan, would be around 35 or 36 weeks. That is to make sure that the baby's presentation, which is head down position called cephalic presentation or any other presentation, and to check for the amniotic fluid index. Other than this, the doctor can anywhere order any additional scans if they think that it is mandatory for your pregnancy. So do let me know in your comments what are your key takeaways, and do let your doubts in the questions, so I will try to answer all of them. Follow my Insta page for regular updates and to enroll for my course. Bye bye, take care. Until I see you next time, stay happy, stay mommified.